So by comparison to the evidence-based for the likes of cognitive behavioral therapy, mindfulness is still in its infancy really. So cognitive behavioral therapy has been around for a long time, so there's been more evaluation. So I think if you're going to say what's the go-to intervention for people with anxiety, depression, particularly I would say CBT would still be something I would recommend, and based on the research evidence. However, this study does provide decent evidence for mindfulness-based cognitive therapy to support the needs of people with psoriasis from a mental health perspective if they have those issues and improve in psychological well-being. So I think this study needs to be replicated, needs to be more research around it, because as I say, there's a couple of other studies around psoriasis and the findings were more mixed. Now this study, I think it's fair to say, has got the strongest power, as they say in research terms, so this is probably the best study out there in this context, but it does need replication. So from a clinical perspective, I suppose, I think psychologists and dermatologists, I think it's fair to say that they should be speaking to psoriasis, people with psoriasis that come to them that might have issues with anxiety, depression and psychological well-being, and talk about maybe what role it could play in their mental health treatment if they were looking for it. So it could be what they call a step care approach, in which someone might do a mindfulness-based intervention and then work towards going into CBT, or if somebody is doing CBT, they may step out of CBT into a kind of a longer term skills-based piece, which mindfulness can be. So they could do the 6 sessions or however long, 12 sessions of CBT, and then maybe they might enroll in a mindfulness-based cognitive therapy group in order to, strengthen the work that they've done before, and kind of embed that and learn new skills and how to approach and deal with their anxiety and depression. So it's a very flexible approach, mindfulness. So I think in time what will happen is interventions will be adjusted and changed. Our research actually provides the basis for which a researcher come along and actually do a bespoke mindfulness intervention for our psoriasis patients based on some of our findings.